to have you back. This is the South African Morning. So if you've packed away those masks and sanitizers, you might just want to unpack them. Experts warn that the fifth COVID-19 wave is beginning, and there's been quite a spike in recent cases. It's believed to be driven by the newly identified Omicron subvariant. So let's get some clarity on this and speak to an expert now. That's High Health CEO Professor Ramneek Ahluwalia. Prof, always a pleasure talking to you right here on eNCA. Should we be concerned? Is there indeed a fifth COVID-19 wave looming here?
So definitely one thing is for sure, Tumelo, good morning to you in 2 years. The important thing is that at 2 years down the line, at this stage, we thought we will be somewhere getting towards the end of this pandemic. But unfortunately, we are far away from a pandemic stage. So which means the virus still loves to mutate. The virus is changing its color and shape to a level that is continuously becoming more contagious, which is becoming more transmissible. And what it's also doing is it's evading our immune system continuously. And what does that mean is breakthrough infections, reinfections, despite 80% of South Africans becoming positive to COVID during the first, second, third, fourth, or fourth wave.
Yeah.
We felt that there would be some kind of acquired immunity, and with some vaccines now being introduced to at least over 60% of the population of our ages above 60, and even 30% and above for a population which is adult. But clearly this virus outsmarts us. It does evade immunity. Our immune system weans off with time, and it takes advantage of that. So I think we are not even close to ending of this pandemic, not even getting it to a stage of an endemic. So I think it's an area of concern. And these subvariants or a new variant, which we do not know currently, the spikes are due to the Omicron subvariant BA4, BA5, which has very different changes of color and shape compared to its previous offsprings, which were BA1 or 2, which we saw in South Africa. And they change clinical patterns too. So yes, it's a matter of concern. I do not know whether this will be the cause of the fifth wave. I do not think so, unless we are surprised here by our genomic sequencing finding that the new spikes are not because of just alone the Omicron existence of BA4, BA5, or we have another new variant, because it's definitely a time for a new variant, which seems to going to be more transmissible and will be the capacity to at least eliminate this Omicron variant away.
Prof, I'm looking at the numbers as you're speaking here, 16.8%. That's where we're standing right now with that positivity rate. We're now seeing numbers of, approximately 4,000 cases a day. But my other concern is, long haul, or rather, I don't know if I'm phrasing it correctly, but long COVID, the symptoms and side effects that those who had COVID are still seeing 6 weeks, 6 months, a year on. Is that also a concern where we're seeing, as you've mentioned before, with our immune system? It seems that long COVID is still also very much a problem even during this pandemic.
Definitely, Tumelo. Now, what you are fighting is an enemy which we can't see. The second, what we're fighting is an enemy which became novel to mankind in 2 years. The third thing where you're fighting is a virus which is extremely mutating and is an airborne disease. It is spread through aerosols. The fourth thing we are fighting here is a virus that's just continuously giving us surprises on daily basis. Now, this is frequent part of viral evolution, what we're seeing with the Omicron currently, which means because our genomic sequencing is strong, we can pick it up early, that these sublineages, which we are the BA4 and BA5, what they're showing us is very different clinical patterns. It's showing exactly becoming slightly more transmissible compared to its previous offspring. And the thirdly, obviously, evading immunity. Now, the question on long COVID is being for people who had COVID, say in the first wave, second wave, third wave, or the fourth wave. With time, their immune systems wean down. And when the immune system, and it's going to wean down, this is a natural phenomena, which means when the immune system weans down, you become more vulnerable, and there's a chance of a breakthrough or a reinfection. But in a long COVID, if you had got an infection, say in Delta wave, or in the fourth wave, Omicron, 3 months down the line, you still have continuous symptoms. Symptoms like the shortness of breath, you have fatigue, we even seeing some cognition aspects, and see not few, many patients.
Yeah.
And that is called living with COVID for a long time, and the phrase is called long COVID. So 3 months, the symptoms persist, or it comes after 3 months and it stays for another 2 months. We continuously use the word long COVID. It's common. And I think that's part of the viral system, and some immune systems make the virus hide in our body, makes it reignite again. And that's what we are dealing as a human body.
So briefly then, before I let you go, Prof, what's the advice around the mask? Because I can see that since the president then made that announcement that we don't have to wear masks, outdoors, but we still have to wear masks indoors, there's a bit of mask fatigue and people really letting their guard down. In this particular time, with the numbers we're seeing, with the positivity rate that we're seeing right now, and definitely seeing the numbers going up, what would your advice be around masks and just vigilance when it comes to mask wearing? Because you did mention, reminded us that this is an airborne disease.
3 quick things, even though the national state of disaster has come. You've got winters in front of you. You've got congregations of people sitting together. If you are in a closed congregation, even in classrooms, you're in laboratories, libraries, offices, in the severe winter where the ventilation is low, wear the mask. And mask wearing inside of the rooms is critical, and it's very, very important, and one of the most definitive way of preventing COVID-19. The second thing is, even in winters, wear more blankets or wear more jerseys, but keep your windows open. Airborne disease requires good ventilation. Check your air conditioners, and cleaning of air conditioners are equally important. And the fourth and the most important advice is get your vaccine boosted, your immunity timely. When your time for booster of immunity or vaccine is, do it. Because what will happen is this virus that tries to evade when your own immune system goes down, this immune vaccine will boost it up back to a level that even new variants are coming in. Hopefully our third line of system, which is our memory T cells, will recognize it and will overpower it, reducing the severity of the infection. You might have small infection, you will have the mild infection, but what we can prevent is the severity and death. So mask, absolutely. Close congregation, when you find yourself, do not to, and please ask others to wear too.
All right. Well, I appreciate this conversation, Doc. Also, I know that sometimes South Africans can be a bit annoyed with hearing, the warning about wearing masks. But when they understand, when they hear from a point of understanding, I think there'll be a better appreciation for this. So I appreciate you, of course, giving us more information about this and clarity. That is, of course, medical expert and High Health CEO, Professor Ramneek Ahluwalia, joining us and talking about those numbers that we are seeing right here in the country. But do stick around.